I've been very fortunate to be involved with the two defining epidemics of our time, Ebola and AIDS. And it started in 1976 when I was part of the team that discovered the Ebola virus. We isolated it and then investigated the first outbreak and just figured out how is it transmitted and what are the clinical manifestations and so on. And then was really defined the basics of HIV infection in Africa, where in contrast to the West, where it was first described, in Africa it's predominantly a heterosexual epidemic. Well, the work on HIV certainly has been the foundation for prevention strategies, for documenting how important the problem is, identify those at most risk, for example in Africa that's young women, and also testing out what works and what doesn't work. And that continues to be the basis for many of the AIDS programs today. A lot of my work, original work in Kenya, was done with colleagues from the University of Manitoba, and in addition, Canada has really done groundbreaking work when it comes to Ebola infection. The current epidemic in West Africa illustrates that it may take many years before something becomes really an issue of major public health importance. And we have really a humanitarian crisis in West Africa with Ebola.